Why are potatoes, assuming we'll exclude fried potatoes, not on your healthy eating plate? And let's take a purple or a sweet one. I'm just curious what went into that. A lot of people ask.
Right, yeah, good question. That in some ways they're a whole food, but of course they are very different than the potatoes that were given to us by the Incas. And we do see that they are a very big glycemic load. So if you compare them to whole grains, we see, as you'd expect by their high glycemic load, higher risk of type 2 diabetes. So that doesn't mean that the potato consumption has to be zero, but not like in the Midwest, we had that white mountain on the plate almost once every day. That's not a good way to be eating.
Hello? I'm just trying to clarify. Are you saying basically that we could have a whole food plant-based diet in addition to a little bit of fish, a little bit of dairy if we so desire, nuts, seeds? That's basically the diet that you're advocating, and I'm just not sure about the oil.
Yeah, first of all, there were ranges, as I mentioned there, and the good thing is that there's a lot of variety in healthy diets. You can eat healthy in lots of different ways. That you can definitely have a healthy vegan diet. But I don't think I think there's no evidence when we get down into these areas of these different healthy diets that one is better than the other. So there's a lot of flexibility. And I think that's really important because we're not going to get everybody under one little tent. And so our ranges there are compatible with having a strictly vegan diet if you want it, but also diets that have a moderate amount of fish and poultry. And the fish, as I mentioned, you've got to get omega-3 fatty acids from someplace, and for a lot of people, that's going to be the best place to get it. And in terms of healthy oils, yes, when the Greeks, when you look at Crete back in the 1960s, where they had the lowest rates of coronary heart disease, they were getting 30% of their calories from olive oil. My Greek colleague says, yes, and that's why we also have the highest vegetable consumption in the world at that time, because it makes them attractive and enjoyable to eat. So there's a lot of flexibility in there, and that's a good thing. As I mentioned, I think there's an interesting question whether you can have a there is a lot of interest, as you know, in people in paleo and very low carbohydrate diets, and I think it's important to recognize that a lot of people do get metabolically much better when they go to those diets because they are having problems with carbohydrate metabolism and can't handle the large amounts of carbohydrates, even the amounts that we might get from a lot of very large amounts of whole grain and in some legumes. And so those people do get metabolic improvements, but you can also have, as someone pointed out yesterday too, you can have even a vegan, very low carbohydrate diet with lots of vegetables, nuts, seeds, healthy oils. And from all we can see, there's been no direct comparison, sort of a very low, all the comparisons of healthy low fat, healthy low carbohydrate look like they're about equal so far. But it's an area where we need some more research. But so far, the good news is that there's a lot of flexible ways to get to healthy, sustainable diets. And I think the bigger the tent, the better, because we need to get everybody in this tent.
Dr. Willett, thank you so much for your presentation. Just one question on your statistics about dairy and the reduced risk of fractures, which we all know and appreciate. One of the most common things that I hear when I'm coaching people to try to improve their diet, and we bring up the dairy conversation, they'll say, oh, I don't drink any dairy anymore at all. I just eat cheese. I mean, this is a rhetorical question, but I would love to hear from you, your position from the evidence. What could I respond to them in terms of their risks and the benefits of reduced risk fractures of cheese?
Yeah, in terms of fracture risk, it doesn't seem like there's any particular benefit or difference between getting the dairy in form of milk or cheese. For other health outcomes, also there's been some idea in some people's mind that cheese is much better than having milk. There was a study, very nice study done in Canada a couple years ago, actually sponsored by the dairy dairy industry there that compared cheese versus milk. And to their credit, they included olive oil and another unsaturated fat. And there was a very slight difference between cheese and milk in terms of effects on LDL. It's slightly favorable to cheese, but the really big bang was replacing either of those with the plant oils. So, and that's also consistent with a paper we published just a few weeks ago in British Medical Journal, looking at total mortality and cause-specific mortality. And cheese was related to higher risk, as you'd expect from these short-term feeding studies. So I think our targets, I didn't mention it, for dairy, I guess I mentioned the range was 0 to 2 servings of dairy a day. But I think it's, and we set the target at 1 serving a day, which would be, and actually preferably yogurt. There does seem to be some advantage to that. If we allowed, interestingly, we said, well, we did a bunch of sensitivity analysis, and what if everybody ate 2 servings of dairy a day? And we go way over the planetary boundaries there. That dairy production has a pretty big environmental footprint. So there's some role in some agricultural systems for some grazing, and if you can, the grazing should be primarily for dairy production rather than for beef production. So again, there's quite a bit of flexibility, but again, this 3 servings of dairy a day is really not justified, and we see that environmentally that would be highly unsustainable, and from a health standpoint, certainly not optimal.
Thank you, Doctor.
Yes.
What if someone don't have the time or don't enjoy preparing a lot of plant-based foods and they just go to Whole Foods, go to the organic salad bar, which is already cut, diced, prepared, and brought home? And I heard something last night and today that something called de-enzyming. I've never heard that before. And I'd like to know what you think about that as far as nutritional effect. And the second question is, like, do you recommend any kind of nutrition to help reverse, like most medical doctors said that arthritis, and they say in the spine, is not reversible, but some people in alternative medicine, it is. And maybe discs, spinal discs that are dried and compressed. I heard this also can be reversed, even though they're drinking a lot of water. And I also heard that something called oleation, which is actually entering oils into the body. So, what do you think about that?
Yeah, well, I guess there's a lot of questions in your question about time and availability and cost and all those things are big factors. And I think we need to find as many ways as possible to help people deal with those stresses, and particularly for lower income people, have big. There's a very strong association, I'm sure you're aware, between income and diet quality, and we can trace that to differences in BMI and differences in diabetes and differences in premature death. Those dots can all be connected. So how do we make these healthy diets affordable, attainable, achievable in practice is something we need to work on. And almost wherever you are, there are things you can do to help make it easier. But we also need changes in policy. But in terms of like food services, a lot of food is eaten outside the home now, and we're working a lot with the Culinary Institute of America and major food services to have more healthy plant-based items on their menu available. There's a recent study that showed just making them more available without any education really substantially increases plant-based food choices. Not surprisingly, if you just got one on the menu, maybe somebody doesn't like some version, doesn't like that particular form of the plant-based diet. If you've got more choices and they're attractive choices, more people choose them. Whether it's in institutions, national policies that actually tip the balance away from the unhealthiest foods being the least expensive, to tip that the other way so that healthy choices become the most affordable choices. There's lots of things, and that's in our Lancet report. I'm not familiar with de-enzyming. I don't know what they're specifically meaning, but blanching foods basically is a way of killing enzymes, deactivating enzymes, so you can prepare foods in advance and they stay fresher. And that's been used for a long time. The arthritis issue is a very big issue. It's a very major part of disability in the United States, and it's astonishing how little research there has been on prevention of arthritis. We are doing some studies now, and I have had a doctoral student I got to work on a project because we have lots of data on that in the Nurses' Health Study, and we just haven't had the resources to touch it. But we are starting to see some important findings there that can give us at least some inroads in prevention of arthritis. But it's an area where we absolutely need more research. I haven't seen any really compelling data yet that we can have a substantial impact by diet. But that doesn't mean it's not there. It's just been seriously understudied. Yes.
Hi. Two quick questions. Number one, when you look at the Predimed and Leon study, there is a great reduction in recurrent heart attacks if someone has coronary artery disease. And so we say oil's safe, but that really hasn't been compared to no oil whatsoever or low oil. In other words, if we look at Ornish's randomized control trials or Esselstyn's anecdotal studies, they get far better results than even Predimed and Leon. And so is it safe to say oils are okay for us if that really hasn't been studied? And secondly, back to potatoes. Glycemic index is really interesting to me because determining a glycemic index in someone with a bunch of intracellular fat eating, animal meat and things like we've already looked at that increases the risk of diabetes, and saying that this potato increases their glycemic index, that's true. But if someone's on a whole food plant-based diet with very low oils and therefore very low saturated fat, therefore very low intracellular fat, they can handle a potato without any problem. And it is probably the most satiating food, so vital part of the diets that I prescribe for patients.
Yeah, there's really been no randomized trial that's been done with high oil or low oil. You're right. Although in some ways, actually, there were in the Leon Heart study, that was a secondary prevention study, not Predimed. But there was a 70% reduction in risk of recurrent heart disease with, again, we can't attribute that benefit to one single item, oil or anything else, because it was part of a whole Mediterranean diet package. But it did, it was, the primary intervention was healthier fats, probably not even optimally healthy fats, because it was in a form of a margarine that did have a little bit of trans fat in it. But there has not been a head-to-head comparison, you're right, of a very low-fat diet with a diet that would have higher fat but healthy fats. And part of it is that it's been really hard to keep people on those low-fat diets. Now, as in a secondary prevention trial, it does seem like there's more opportunity there because people are sort of just one foot in the grave and pretty high motivation there. So it would be nice to have such a study. We don't have that now, but what we can see for effects on lipids and risk factors, they are better replacing some of that carbohydrate with some healthy fats. And that's about the extent of the literature that we have. Now, with the issue of potatoes, if you have somebody who has really low insulin resistance, they're lean and they're active, then we can tolerate potatoes much better. But if you take the average American, they cannot tolerate them very well. So I think if we're talking to the general public, it looks like there is a problem. Being lean and active makes us, we have much lower insulin resistance and we can definitely tolerate more carbohydrate. But as I mentioned, it is a doubly serious issue globally because it does, I could talk for about 10 minutes or so on this, but in Europe, it looks like people who are more resistant got selected out over the last few hundred years, not entirely, so that diabetes risk is lower. But even in the Nurses' Health Study, The European women had the lower, everything else controlled, much lower rates of type 2 diabetes. Asian women, Hispanic women had 2 to 3 times the risk of diabetes, everything else controlled. And it does, more careful studies have shown that there's much less tolerance for higher carbohydrate intake in minority populations, which are really the majority populations globally. As I mentioned briefly, if everybody has a really healthy diet, then diabetes risk will be low. But increasingly, the rest of the world has become much more sedentary, which if I could turn a dial and change that, I would, but that's a reality, and can tolerate carbohydrates much less well than they did before. So we do have to be careful. This is one area where it does seem like there are some, depending on people's origins, different rates of, different prevalences of insulin resistance. And what we see happening, like in India, the rates of diabetes are in urban populations now, according to my colleagues who have done a recent survey, they're up at around 50%. And actually that was true. The very first study I did as a medical student was a survey of Native American population in the Upper Peninsula of Michigan. And there we found rates of diabetes that were 4 times higher than in the general American population. And that's what seems to be happening worldwide now. So we do have to be very careful about higher carbohydrate diets in that kind of context. And especially, and your point is well taken too, these higher carbohydrate diets could be tolerated while everybody is very lean and active and having less refined carbohydrates, but that picture has changed. There's television everywhere. People are riding around instead of walking and bicycling, and that all converges to be part of a perfect storm of many factors that are coming together to create this global epidemic of diabetes that's happening right in front of our eyes. It's what we saw in the Indian reservation in northern Michigan almost 60 years ago now, and it's happening on a global scale at this moment.
Number one, I wanted to thank you for your work with the Culinary Institute and wonder how you are working with the students, because I find if we go to restaurants, sometimes it's really hard to find a good vegan option. So I was wondering exactly how you're implementing it. And two, I was wondering if you're familiar, Jack Kittredge from NOFA, Northeast Organic Farmers Association, has written a white paper on carbon sequestration through regenerative farming. The Bionutrient Food Association is doing no-till, cover crops, and talking about carbon sequestration. And Eric Tonsmeyer has a book on that topic also.
Yeah, well, with the Culinary Institute, that we sort of have some joint mini courses we're putting on. And basically, our group from our department teaches the nutrition part, and the Culinary Institute, which hopefully motivates people and it gives them the rationale for improving what they're offering. And the Culinary Institute then sort of shows how to put that together in terms of real meals and menus. And that's been really good. That allowed us to get trans fat out of the food supply much earlier, because before those joint programs, the food service people had not even heard of trans fat, much less understand what it was doing. And so they spent a lot of effort then essentially taste testing, reformulating menus. So when the ban came, they were prepared. And that worked also without getting more whole food, more whole grain options on the menus. And we have been, over the recent years, having more plant-based options on the menus too. So I was just out at the retreat a couple weeks ago and had some sessions on creating healthy plant-based veggie burgers. There's, as you all know, sort of Impossible Burger and Beyond Beef Burger are out there, but those are not the healthiest options. There's a lot of room for creating, there's a whole lot of horrible veggie burgers out there too. What we want are good veggie burgers that people enjoy and want to eat, that are aspirational, because they know it's good for planet, good for their health, and it tastes good. We have to hit all three of those. So that's basically what we're doing. And yes, there's a lot of interest, as you said, in regenerative agriculture, but we need a lot more investment. In our Eat Lancet report, we had some experts in that area on the report, and so far the literature from their view, I'm not an expert in this, is that there's a lot of variability in terms of how much carbon can be sequestered that way. So we need to understand how best to do it, where to do it, and there's not a universal simple solution, it seems, in that area. But it's really good that we need more people working on this to understand how to do it as well as we can, because that big green section there on that pathway does assume that we are going to sequester a lot of carbon, and doing it through food systems is almost for sure going to be the best way to do that. So any additional efforts in working on this and documenting and studying what works and what doesn't work under different conditions, that area is in great need of much more investment.
Dr. Willett, this week the media has been doing reports on increase in life expectancy. They've been saying that it's partially due to the decreased deaths in opiate overdoses and decreased rates of death by cancer. But all the information that we've been receiving so far at the conference has stated that the death rates have leveled off. Are you aware of what's being reported on right now?
Yeah, I haven't seen the details of that new report. So we have made some progress in the opiate control area, and that will definitely help. But it's not going to, and we should put even more efforts in there. So it's possible that we can see some little recovery from this 3 years in a row decline. But the underlying trends are very worrisome here, that even before the epidemic was occurring, the opioid epidemic was occurring, we were leveling off, and in other countries like Japan, we're charging ahead. So yeah, we'll need to keep an eye on these data, and hopefully we will have reduced some of that contribution to the opioid epidemic. But we've got to deal with these longer-term trends as well. Great. Well, thank you.